before I enter the medication room, I clean my hands and apply the gloves first. And then go to the medication room, open the patient MAR to check the medication due right now. It's 6 p.m. So based on the medical record, there are two medications due. One is the Ketorolac, 20 microgram. The other one is the NPH insulin, 7 units. And for this medication, the nursing consideration is like for the Ketorolac, it has a risk for bleeding, so I need to double check if the patient has the active bleeding or if she is pregnant. Also, this medication was processed in the kidney. I also need to double check if there is impaired kidney function of the patient. So check in the medical report, it's cleared. And for this NPH insulin is an intermediate action insulin, so it usually take action within 1 to 2 hours. So I want to make sure to double check the glucose level of the patient first before I administrate this medication, and also I want to make sure the dinner will be served within 30 minutes after the medication. Okay, then I start to prepare the medication. So first, open the cap for this Ketorolac. The concentration is 15 microgram per ml, and the expiry date is next year. Is good, so I need 20 micrograms, so the total volume will be 1.3 microliter. So draw some air into the syringe, and then push the air into air, and then revert, draw the amount, which is 1.3 microliter, no, milliliter, and get rid of the bubble. And then use one hand technique to recap, and then double check the medication volume is correct, and then change the needle as indicated. Okay, and then I make the label for this medication to label out the medication name, medication concentration, amount, date, time, patient's name, and my initials. Also, the medication time will be 6 p.m. And at the same time, I have already pre-made the other medication, which is the NPH insulin 7 units. And for the same patient, same date, and 6 p.m. And then I put this rest of the medication back into the Pixie, and close the patient MAR before I then enter out the medication room. Then take off gloves, perform hand hygiene, and then take the medication I'm prepared, and the other supply I will need move into the patient room. Need some alcohol pad here. Okay. So now I step into the patient room. Knock, knock, knock. Hi, how are you today?
Hi, good.
Okay, so I'm the nurse today. I will come to give you some medication around the dinner time. Can you tell me your name and date of birth?
My name is Ivana Barrios. My date of birth is May 9th, 1999.
Okay. Before that, can you tell me if you have any allergy?
No,
Okay. And do you have any pain right now? If on the scale from 0 to 10, can you?
4.
It's 4.
Yeah.
Okay. Okay. So since you have some pain, and I think it's the right time to give you some pain medication, which is the ketorolac. This medication is like will help to alleviate your pain, and it also has some effect of the anti-inflammatory, but it has some effect may cause some bleeding. Do you have any active bleeding right now? GI bleeding?
No.
And are you pregnant?
No.
Okay. And also just let me know, this drug will be processed at your kidney. So I just double check in your lab, your kidney function is okay. So you're clear to give you this pain medication. And the other thing is insulin. I will tell you more details about it later, but it just because of you because you have the diabetes. Okay. Then we have wear gloves. So I will scan your wristband quickly here, and then scan this medication to make sure it's the right patient, right medication, right time, right amount, right route. Yeah, that's basically the 5 rights. Make sure, and the dose is correct. Make sure, and also check the expiration date of this medication. It's good. Okay, so this one will be administered by intramuscular. So for intramuscular injection, there are basically 3 sites I can do. So first is in your arm. It's like 3 fingers down here. It's here. And the other one usually we do here for the adult immunization, I mean vaccinations, and for a small amount of the low dose medications, because the muscle here is kind of small. And the other option we can do, can I open your, yeah. The other thing we can do is the vastus lateralis, this big muscle here. So we can do it's around this area. So we can do some deeper injection, and also usually we do like kids vaccination in this position. And the third side will be the ventral gluteus here, ventral gluteus side. Here is your right leg. I will use my left hand to locate. So it just here, it will be this triangle between the index finger and the middle finger. Yeah. So which position would you like to choose to get this medication?
Right here.
Okay. Okay, so first I will access the skin of this area. Make sure it's like no discoloration, no bruisement, so it looks normal. Okay, then I will use the alcohol pad to clean the skin briefly. So I will move down here, clean the skin briefly, and let it dry for a while. And then in the can, squeeze a little bit. So here I want to show the Z-track technique is which I use the non-dominant hand to move the skin and the tissue to the side to 1 inch, and then inject the needle at 90 degrees. Then injection. Then take out the needle at the same degree, and then release the skin and the tissue. After that, just if there is safety device, apply directly. If no, just trash it into the sharp container directly, and apply mild pressure onto the skin, and then apply a bandage onto the skin. Okay, and then for this insulin, as I mentioned, so this is to treat your diabetes. It will help control your blood glucose level. Make it after foods, usually your blood sugar will get high, but this one will help control, keep it lower. But if you don't have the food soon, then it will be, your blood sugar will be too low. Probably you will feel dizzy, or you will sweating, so not very comfortable. So I will make sure after this medication, your food will be delivered to your room within 30 minutes. Okay, so this one I will give you by subcutaneously. So there are 2 locations. We can do either at back of your arm or in your belly. Okay, so and do you remember which side you did last time?
The left side.
Okay, so usually we do the rotation. This time we will do on your right side.
Okay.
Okay. So clean your belly, and then let it dry, and then take it out. Double check the right medication, the right dose, right time, right patient, and the expiration date is good. Okay. And then scan your wristband and scan the medication.
Yeah, it's up at the front of it.
Okay. Sorry. Redo clean one more time and let it dry. And squeeze the skin gently. And do like at 45 degrees. Okay. Then apply the safety device immediately. Apply gentle pressure. And then here's a bandage. Okay. Then press this into the sharp container. Then clean my workstation. The other thing I forgot to check with you is, I think I checked with you the pain medication you said is 4 or something, right?
yeah.
Okay. Then I will clean my hands and open the computer to make sure record all the medication and the care I have given to the patient and the other condition like patient have right now. And then I go back to the patient to make sure she is in a comfortable position. Do you need to go to the bathroom? Okay.
No.
And do you feel any pain right now?
No.
No. Okay. And here is your belongings, and probably later someone will send dinner here onto this table so you can have it. Okay. And I'll make sure the collet is within your reach and the bag is locked. Okay. Call me if you need anything from me. Okay. Okay.